Welcome to DocPod. Hear health.
Welcome to DocPod. I'm here with Dr. Joe Pazona, who is a board-certified urologist and is currently the CEO of VirtuCare, which provides urological training to APPs, including nurse practitioners, etc., as well as surgical services in rural healthcare systems. He is also the CEO and practicing urologist at Pazona MD in Nashville, Tennessee, and the surrounding areas, and is the host of the podcast Balls Deep with Dr. Joe Pazona. Welcome to the show, Dr. Pazona. Glad to have you on.
Thanks, Jeremy. Appreciate the opportunity.
Absolutely. So, tell you what, my favorite part of the podcast, other than the content, is just the guy with the music in the background. I don't know if that's you, but it just goes balls deep.
No, that is not me. I don't have that quite that good of a bass. But my wife is an actress by training and had some friend record it for us. So yeah, we've had fun with the podcast for sure.
It's fantastic, and you hear like the intro in the beginning, and then it cuts straight to that. I the first time I listened to it, I just started cracking up. I was like, this is hilarious. But the content is pretty amazing, and I got a chance to listen to several of them. One of which struck me, and I wanted to touch on this, and I don't want to repeat an episode of your podcast, but I've got a family history of prostate cancer. And I listened to that episode among others. And one thing that struck me that I never knew, and I'm certain a lot of people didn't as well, is that, excuse me, let me back up here. Touching on erectile dysfunction, I want to touch on prostate cancer in a minute, but erectile dysfunction, that is a potential precursor or a marker for heart disease or failure. And who knew other than you and urologists, but kind of in the patient population, the general public, can maybe talk about that because everybody experiences it, whether you're 18, 25, 65, 90. So tell me a little bit about that if we can.
Yeah, absolutely. Jeremy, erectile dysfunction is the canary in the coal mine in that for men who have erectile dysfunction, especially starting, say, in their 40s and later, it's almost always due to narrowed blood vessels, what we in the medical community would label as atherosclerosis. And that should ring a bell for people listening because that's the same process that leads to heart attacks and to strokes.
Right.
And because the blood vessels going to a man's genitalia are only about 1 millimeter in diameter, so not very big, even a little bit of plaque is going to, and blockage is going to lead to an erection that's not quite as firm or one that kind of goes away. And so, this is the exact reason why with our practice at Pazona MD, I'm so passionate about all things wellness and lifestyle. Because I've had some patients go, wait, you're a urologist. Why are you talking to me about my diet, my exercise, and all of this? Almost every condition I treat, starting with erectile dysfunction, has a root cause in all of the lifestyle diseases: obesity, diabetes, hypertension, atherosclerosis. This is the exact formula that's going to lead you to erectile dysfunction, and then 5 to 10 years later, your first heart attack, and then eventually a stroke. And so I think it's so key that we move away from the sick care model of you come in with symptoms, I label you with the diagnosis, and I push the little blue pill on you, and then, okay, move on, next patient.
Right.
And that's what I think a lot of these digital pharmacies are doing online too. We have such a unique opportunity to reach men who, let's be honest, we're notorious for being terrible about going to the doctor. And so what a great opportunity to educate men about what's truly going on. Now, I don't want guys listening to this thinking that if you've had a little trouble with erection, it means you're going to die of a heart attack. There are plenty of guys in which stress is playing a role, lack of sleep. You had too many glasses of wine last night, and that's why you didn't perform. And then the anxiety performance kicks in. But this is a key aspect that we're trying to drill down on the podcast and kind of move to that medicine 3.0 version where we really look at root causes and stop just pushing the pills.
And I love that because I think with the knowledge that one may potentially lead to the other, and the other being a heart attack or failure or disease, something to that effect, it takes a lot of the pride factor out of it, right? Because if you can't get it up, you're not necessarily jonesing to go to the doctor or tell people about it or have a conversation with anybody about it. But at that point, it's, well, this may lead to another very serious problem. And I'm okay with talking about that.
Yes, absolutely. And that's why I feel urologists should be at the forefront of wellness as well as men's health and even women's health. We have a privilege in my profession of meeting with people at their most intimate and vulnerable time.
Mm,
It's hard for a guy to come in and talk to me about his erections. Now, for me, it's just another day at the office,
right.
but I appreciate how vulnerable that man is who's sitting across from me. And I owe it to him and to his loved ones to address this as an overall picture of his health and then to provide those solutions to make sure that he gets well and doesn't have that event down the road. So I think it's so key that we start talking about this more. We stop pushing drugs, and I'm tired of all the pharmaceutical commercials every time I pop on the television of happy sick people dancing because they got their Jardians. Like,
Well, right. And then the last 45 seconds to 3 minutes is the side effects, which is just longer than the actual commercial.
yeah, and then we have a follow-up commercial to Hardee's or BK, have it your way. I mean,
Right.
like, what are we doing, people? Like, and I get it. The whole system's broken. I speak about this a lot as well. We're in the sick care mentality where, again, symptoms, diagnosis, pills, and the insurance industry certainly doesn't help it, where it's a volume-based game. In order
Mm,
for us to keep our doors open as physicians, we don't have time to sit down with you and educate you on this. And honestly, our education on it is not that great. Most of what I'm doing, I've learned on my own in the past 5+ years, to be perfectly frank, because I selfishly want to live a while and live a good life. So I want
right.
to make sure I know this for myself, but I also feel like I owe it to my patients. And I've never been comfortable with these silos of medicine where we just kind of we know the ship is sinking and we're just kind of putting a band-aid over a hole. We've got to move away from that.
And I appreciate what you mentioned before when you say that on the podcast, but also in your practice, you focus on wellness, men's and women's. But you talk a little bit in one episode about GLP-1s, GIPs, and hormonal imbalances, and how maybe a peptide treatment or something can be a treatment for, as you mentioned, hypertension, diabetes, obesity. How do you tie that in wellness into your practice of urology?
Yeah, so the first thing that we've done is to really build a system that is not volume based, and I think the linchpin to that has been that as of January 1, we have opted out of insurance
Mm,
because it's really hard to focus on wellness when there's no reimbursable code for wellness,
right.
because it's not a sickness. Um, and then again, if you want to keep the doors open, you have to see a certain volume of patients. And as a surgeon, I'm incentivized to do things to patients because that's how I make more money, by doing procedures and offering tests. And it's just a perverse incentive, and I've never been okay with it. And so I think it starts with you've got to have a model that is sustainable that can deliver it because, you know, uh, we still are running businesses. We have livelihoods. We have families as well. And
Mm,
certainly, I don't ever like pulling out my little violin to write an ode to the poor doctor who doesn't make enough money. But I don't think most people realize the reason your doctor sold his practice to the big hospital system, private equity, he literally couldn't keep the doors open.
right.
And so it's got to start with that bigger discussion, Jeremy, of we have to have a system that first off incentivizes it. And then second, you know, it's taken a lot of effort on my own to learn about this. We don't learn about wellness in medical school in our
Mm,
training. Again, we learn about diseases, illnesses, and treatments. And so I've had to create the bandwidth to even learn all of this again. Because here I am as a urologist and I'm restudying lipid panels and GLP-1
mm,
agonists. But it's interesting. We become so segmented in healthcare, and I know I love what you guys are doing with DocPod. Is you're creating these expert channels, right? You got the
mm,
pulmonologist, the GI, the urologist, the primary care.
mm,
We're all still doctors. That doesn't mean, just as I don't expect my primary care doctor to never address a patient's erectile dysfunction,
right.
it would be irresponsible of me to not address wellness with a guy sitting across from me who's clearly obese, pre-diabetic, and coming in with erectile dysfunction. We can't be in these silos that are so super specialized. We forget the fact that we've got a human being in front of us, and there's a cascade of events that have led to these diseases and symptoms. And so a lot of it's just the mindset and philosophy that I've adopted. But I know it's going to take time to get that out in with other docs because they're burnt out. They're in the broken insurance system of sick care, and they're just trying to get by every day.
And you make a really good point when you talk about the silos of healthcare, because as a practicing urologist, I'm certain you have seen all of those types of patients with every type of illness aside from anything neurologically based or focused. And so, maybe stepping outside of not necessarily the training, but the hamster wheel you have been put on, where it's a churn and burn and it's incentivized procedures and tests and all of these things. So bringing back the Hippocratic altruism into healthcare is what you're talking about. I really respect that because it's in my opinion, and I've interviewed in my career thousands of physicians in every different specialty. I used to be an agent for locums physicians in surgery specialties, so urology being one of them. And it's interesting. A lot of those gentlemen were older, just kind of sunsetting careers and getting into locum tenens work because of the physician shortage, and we'll talk about that in a minute. But there wasn't anything wrong with them. There wasn't anything wrong with their practice or, with what they had been trained to do and had done for 30 years. But, in my experience, there wasn't a focus on wellness, not really to their fault, but it just wasn't anything that was brought up in conversation. And as of late, you've seen a ton of that. And I think we should leave it to the doctors to do it. But it sounds like a chicken or egg scenario, right? Can you walk me through how you got into that, maybe, and where you see that going in healthcare in general?
Yeah, Jeremy, you bring up an excellent point. I mean, the fact of the matter is I did 6 years of urology training, and if you have a kidney stone, I'm the guy who's got to take it out.
Mm-hmm.
And if you go into congestive heart failure, don't come to me, go to the cardiologist who has spent decades managing that. But we have this epidemic on our hands of obesity and illness, and it seemingly we're just not making any headway. We're just throwing more and more drugs at it, and these are diseases of lifestyle. And so, what has been my motivation? Well, part of it is out of self-sustainability and that, here I am in Nashville, you could throw a rock and hit a urologist in the head. There's plenty of us to go around. So if Joe Pazona isn't quite doing as many kidney stone removals, the people in this area are okay. And so I'm really looking at what are holes that I can help fill by building a team and a process and a model that starts really addressing these issues. Because all I see is just volume-based primary care. And again, they're on the hamster wheel. I don't blame any of my colleagues, and I don't blame any of my urologists who are continuing to remove prostates and kidney stones. We need that. But somebody has got to step back and say, hey, folks, this ain't working. And it's a clear path as to where we're headed, and it's not good. And there are, I think, a number of models and physicians on a very micro scale, whether you call it longevity medicine, concierge medicine, where people are really able to work with a small subset of people and, help those individuals who've got the means and the education and the finances to cover all of that. But I'm curious as to how we can make bigger societal changes. And it's we're in an uphill battle, So I think it's out of sustainability, in that I've wanted to again see in our competitive marketplace how Pazona MD can be different.
Mm-hmm.
It's out of interest. Again, selfishly, I'm in my late 40s now. I feel like I'm headed toward the best shape of my life, and I am right now, and I want to stay that way. You start having aging and dying parents. Your kids go from in your arms to taller than you at the snap of a finger, and you go,
Hmm.
whoa, life life's moving quickly. Like, and I understand why people have midlife crises, and
Right.
maybe this is my midlife crisis. Instead of going off and buying a sports car, it's tackling these issues. And I love it. I really do. And what I love about it is that it's resonating with patients. I think there is a bias amongst myself previously and most colleagues that go, patients don't want to hear about this. They don't want to be told they got to eat healthy. They don't want to be told to exercise. And I'd argue that they actually do. When I sit down with them and go over this, they're like, oh my God, you're spending time talking with me about this. This is great. And you'd also be surprised if you get curious and lean in how much misinformation is out there. I
Yep.
mean, I've had patients look me in the eye and go, what's skim milk? Like they didn't know there was a difference between whole milk and skim milk. I've
And
had
that's
people so it's like information on that. I've had people who think that their bowl of cereal is healthier than eating what I just had for breakfast, which was 4 eggs.
right. And it's
Like
just a
so,
cup full of sugar.
right, exactly. And so it's fun to make those changes with people and to then start seeing those stories, and even as a urologist, I had a gentleman recently. He had the means, he had the intelligence, he had everything he needed at his fingertips to be healthy, but he was 75 pounds overweight and struggling.
Mm.
He had a great concierge doc, everything. And for him, we did a discovery and realized what the missing piece was his hormones weren't optimized. So we got him started on some safe hormone optimization. I walked in the office 5 months later, and Jeremy, I did not recognize him because he was lean and mean and a giant smile on his face. And I just went up and went, man, look at you, shook his hand. And then he goes off to tell me all the things he's been doing over these 5 months and how much more energy he's had and how he's now studying longevity medicine and working with his trainer and all the dietary changes. And all he needed was that sort of that missing piece to slot in, and all of a sudden the whole world of wellness opened to him personally and on a bigger scale. And so it's stories like that that go, you know what, you are doing something that matters. This can be done. And although that's, excuse me, that's one gentleman, there's no reason we can't scale that to help, tens of thousands of more people.
Oh, absolutely. And I think to maybe a couple of your points, you just mentioned an example. Gentleman had education, the wherewithal, the ability to do all of the right things that he could have, was 75 pounds overweight. Talk about somebody who thinks that whole milk and skim milk are the same thing, that cereal is healthy, all of the misinformation, but also just the lack of education and awareness. So that has to knock down that barrier between physician and patient to say, they probably don't know, and they do need to hear about it. And if they do, it's obviously a personal choice at that point. But I consider myself pretty well read about this topic. I go to the gym every morning and I'm in pretty good shape. So I understand all of these things, but to the common person, they don't. And if they hear it, then the light bulb goes off. And you talk about losing an entire person in 5 months and being able to sleep and keep your eyes open and all the things during the day. So how do we get past maybe not necessarily the physician patient conversation or the hesitation to have that, but how do we get past just breaking down the barrier of evangelism for wellness in a sick focused society of healthcare?
Yeah, I mean, it's going to take a while, Jeremy. And I think what you guys are doing here at DocPod is the way to go. You need physician leaders who are providing the correct information. We live
Mhm.
in the age of, in my opinion, misinformation. There's plenty, you can Google now and AI and Chat GPT and get a whole bunch of stuff, right?
And
And,
believe it right away just because it's what you see.
absolutely. And we also have, I think, people with a lot of clout who are celebrities
Mhm.
and, they're going on with whatever their agendas are and are promoting things. And some of it, like a Dr. Peter Attia is fantastic. I mean, a brilliant scientist who I follow and I get a lot of my information from. But then we have some other people who are in show business running healthcare companies, and I'm going, what are you talking about? Where's this
Right.
coming from? But yet they're trusted, right? I mean, it's our human nature to trust somebody who's, quote, an expert or celebrity or is well known. That's why we buy products when some celebrity endorses them.
Hmm.
So I think what you guys are doing is key, and I love that you're aggregating, accurate healthcare information, and that we're going to start talking about this more. I mean, we just have to get this in our narrative. We have so many issues in this country, Jeremy, that we talk about, and whether you're on the right or the left, I think both extremes are wrong in my opinion.
Hmm.
And they're just talking about these issues, and it's like, is that truly what's important to our society? I mean, I could make a strong argument that obesity and the healthcare system should be everyone's number one priority,
Agreed.
because it is the one thing that unites all of us. It is the one thing that will affect every single human being. We are all going to die, and most of us are going to get a chronic disease.
Hmm.
So why is it that we're not talking about this more, and instead we just have these, ridiculous arguments about, the Affordable Health Care Act that was passed how many eons ago, or
Hmm.
even, the pandemic, which were, 5 years past, and still arguing about, vaccines and a lot of these other things. We should really be shifting the focus on things that are going to truly make a difference. So I think we just need, more trusted sources like DocPod. We need more physicians like myself having a platform to preach this. And that's going to be the only way we start getting some sort of headway on a bigger scale.
Well, I appreciate the kind words and support, and that's exactly what we are doing and building here. But to your point, healthcare and patient care is purple. There is no blue or red. There is no side of that aisle, because it affects literally everyone, whether you believe one thing, the other, or nothing. You are a human, and you have probably all of these issues we just talked about in one way, shape, or form, or someone who does. So these issues affect every single person on the planet. So I can't stand it when healthcare is politicized, and when something may be right or may be wrong, but it's because of whatever the politics is behind that person, it's the wrong thing, whether what side of the aisle you're on. So I don't know how loaded this question is, but what do you think a solution to that may be with big healthcare, big pharma, insurance, everything that we've got going on for the last 80, 100 plus years in healthcare? But we're starting to see like a grassroots movement of an awakening of sorts in wellness. How do you see then maybe the next 5, even 10 years with what you're doing in your practice, maybe having a trickle down effect into others?
I would second what you're seeing. There is a grassroots movement, and these things are gonna take time, and it's going to be a multi-faceted approach to get us to where we need to be. And we all know that we're never going to get to that panacea. We're never going to
Right.
get to that point where, there's not a single processed food in our country, and everyone is, a normal, healthy weight like we were when probably you and I were kids, and you
Hmm.
could you
Drink out
could
of the
count.
hose.
Yeah, exactly. And you could count the number of kids who were overweight on like one hand, in
Right.
your entire school. So, there's several things. Again, is building that awareness with correct information, what you guys are doing here. Number two, what I'm trying to do from my end is to encourage more physicians to break free of their golden handcuffs, to break free of insurance, and either start or join a entrepreneurial healthcare organization.
Mm.
Because as long as the people delivering the health are focused on sickness and pills, we're just on that hamster wheel.
Yep.
And we don't need everyone off the hamster wheel, but we do need a certain percentage of people off of it, and especially in the primary care space where, kudos to all of my colleagues in primary care. You have a yeoman's task to, in 10, 15 minutes, even make a dent in someone's healthcare, given the fact that you're being told by administration, unless you see X number of patients a day, they're going to fire you or you're not going
Hmm.
to even make your salary. So the only way is to, we're not going to all of a sudden fix a broken system. We just got to create a new one. And, that's what we're doing, where we opted out of insurance to opt in with our patients and take out the middleman, make it such that a patient can take their hard-earned dollars and directly spend it towards wellness. I don't think people realize how many tens of thousands of dollars are wasted per family on health insurance, and the large majority of it is not going towards your health.
Hmm.
It is going towards the dividends and the stock prices of United Sick Care Group. I mean, it is absurd in this country that we allow profits over patients, and that these organizations, I mean, the primary way they make money is they take our money and don't let us use it towards healthcare. I mean,
Right.
it's nauseating. But I also realize that stopping a tens of billions of dollars gorilla with strong influence is going to be hard, but we can do it if all of us just start taking our dollars and putting it towards independent practices. More physicians leave the system, because guess what? The core of healthcare economically is a patient seeing a physician.
Right.
And if that doesn't happen, the entire house of cards comes crumbling down. And so there's only 1 million physicians in the US right now. It's not a lot,
No.
so there's no reason that if we can't continue to foster and create systems. And so that's what I'm excited about with, what we're doing at Pazona MD, is creating a place that we can hopefully attract, as well as build a model that we then go to a colleague and go, hey, I've already worked out all the kinks. You could do the exact same thing in Atlanta or Charlotte or Omaha, Nebraska, you name it. And also why we're doing the work we are with VirtuCare, where I've created a new sort of job where I take those physicians at the tail end of their career, the physicians who are burnt out and tired of that system, and put them in more of a role where we're improving access in rural areas, and we're moving towards what we really are, which is teachers. I mean, a
Mm.
physician really is a teacher, and that's sometimes the best way we can heal. It's not by cutting on people or pushing pills, it's by educating and guiding. And we can't ever lose that human element and touch. I mean, a lot of what I do is just put my hand on someone's shoulder and say, you're going to be okay.
Hmm.
That is, AI will never replace that interaction. And so I think that's the key, is we've got to look at every healthcare business and decision through the lens of how does it affect that patient-physician relationship? And we've got to give patients the access to the right people, and we've got to start protecting our physicians, because I don't think people appreciate how many of my colleagues are burnt out and miserable. They are not bad people. They're most people I went to medical school with, I remember what they were like, and they're now just a shell of themselves because the system has beat them down.
Hmm.
And again, a million is not a lot of doctors. And so if we don't start protecting them, what's going to happen one day, Jeremy, when you and I get sick? Who's going to take care of us?
Well, I'm glad you pivoted to VirtuCare, because I wanted to talk about the work that you're doing there, especially with the ratio you just gave, right? So there's 1 million to roughly 300 million physicians to patients, potential patients in the United States. There are roughly 300 or so urologists coming out of residency and fellowship programs yearly. And good night. And they're not being replaced even close to fast enough as they retire, which is why I ultimately got into my first job ever, which was a locum tenens consultant. And so uh, with VirtuCare, the motivation there was exactly what you just mentioned, right? There's not enough physicians, especially in rural areas. So can you tell me a little bit about the teaching, training, services you're providing in the Nashville surrounding areas, and maybe how other people can replicate that in similar areas that have, the ability to do so?
Yeah, I mean, and really it was born out of necessity. I practiced for 8 years, Jeremy, in rural Washington State, and I saw so many patients who were just not getting the treatment they deserved because they didn't have access to a urologist, or because
Hmm.
their small town primary care nurse practitioner was just doing the best they can, received very little urologic education, and, sat on a patient who should have been sent immediately for a consultation, but in the same breath sent over someone who had absolutely nothing serious going on, within a week. So again, that concept of having to educate as a physician. So, really what we're doing is over the past 4 years, we've been partnering with rural healthcare systems, and the model is such that we help them to recruit a local nurse practitioner. And then our team puts them through all the training of a urologist. Now, I'm not going to teach a nurse practitioner straight out of school in 12 weeks everything I've learned in 20 years,
Mhm.
but put them through at least a mini fellowship. And then the beauty of the model comes in where they open up a clinic with our guidance. And then day one, they've got a board certified urologist, just like you have one right now. You
Right.
dial them up on a Zoom call, and there I am virtually. 2/3 of urology don't need these hands. They just need my guidance.
Mhm.
Let me walk you through erectile dysfunction. Let me talk you through how to prevent your urinary tract infections. And then what we do is we periodically send surgeons to the facilities to do hands-on care when that comes up. So now a hospital essentially that had zero chance of getting a urologist. And we know that because the job's been open for 5 years. And as you said, the numbers just don't work. I mean, there's right now over 1,000 job openings for urologists. And the majority of the 300 urologists coming out of training will take zero of those jobs.
Right.
They're just going to come join me in Nashville, or the big group in Charlotte, or the group that their buddy joined in Cincinnati.
Mhm.
And we don't have to advertise. People just find us. So it's just simple math and economics. And so it's exciting to provide care in that sort of fractional urologist. When I go to these hospitals, I say, I'm going to give you just the right amount of urologists you need, and not any less and not any more, because I think also people don't realize, and this is something we should be talking about, rural hospitals are closing on a daily basis.
Really?
And people go, well, whatever, who cares? Why are you living in some area? Well, the fact is, if we don't have rural hospitals to care for different regions of rural populations, guess what? They're all going to get shipped 2 hours to your hospital, and then you can't get in with your doctor.
Right.
So it's a problem. Again, it affects everybody, but no one's talking about it. And so I'm excited that with our model, we're creating profitable service lines for hospitals. We're providing exceptional care and access for patients who had zero before we showed up. And we're now creating jobs for physicians who felt burnt out and felt like, well, I guess I'm either going to retire, invest in some real estate, or I guess I have to go travel and do locums away from my family a couple weeks a year just to make my salary,
Mhm.
because and they don't have to do that anymore. So it's really a win for every stakeholder. And I think, the best way they can get involved, contact me. This is seemingly simple, but it's been very difficult to execute, and it's taken a while to get our name and our brand out there, because I'm now trying to get the attention of busy hospital executives worrying about razor thin margins, their next JCO inspection,
Mhm.
and losing docs. And I'm going, oh, hey, I'm Joe Pazona. Could I interest you in some new model you've never heard of, right? So needless to say, it's not as easy as it seems, but we've gotten really good at it, and we are absolutely interested, Jeremy, in expanding into other specialties. And so there's no reason this model can't work in many areas of the country, and it is. We're open with partnerships from Montana to Virginia. And we're in discussions with other specialists actively at this moment. So I'm excited about it. And I think it's, again, this is where I want my efforts to be, building a different system, building something. I don't need to remove my 1,000th kidney stone, but if I can figure out how to help remove kidney stones in 10 other communities that have nobody now,
Right.
that's time well spent.
And what a great idea and business model to be able to potentially triage some of those things, or patients as they come in the door, to a nurse who has been trained by a board certified urologist, and then a click of a button, hey, he's here if we need you. and then with the surgery behind it, if and when necessary. But I love that. I love the model. I love the work that you're doing. And I really appreciated the time here. It's been great to spend with you. And I want to do it again here soon. I know you got your podcast and your practice and your business, but let's find another 30 minutes, 40 minutes here in the future, because I'm really excited about what you're doing. But thanks for being on the show, Dr. Pazona.
Jeremy, thank you so much. It's really, my pleasure. And it's things like coming on your show and what you're doing with DocPod that is a priority for me. So I will absolutely be back, because I feel right now my biggest impact is on a larger scale. It's not on a micro scale. And that's why I'm building a team such that I'm not in there every day seeing patients. And here's the beauty. I'm not burnt out.
Right.
I love what I'm doing. I'm a physician in the middle of my career, and I'm just more excited every day. Don't get me wrong, I have my frustrations and moments where I go, boy, what'd you get yourself into? There's some great job in, rural X where I could just make 3 times what I'm doing and stop with all this work I'm trying to accomplish. But no, it drives me every day. And again, Jeremy, I really appreciate the opportunity. I love what you and Paul and the team are doing with DocPod. We need to get accurate information out to the entire country. It needs to be physician-led. There's too much medical information coming from pseudoscience and people who don't even understand the basic tenets of science. You need real practicing clinicians talking about these issues and to gain the trust back. We have this a physician used to be a revered profession. And I don't think it is anymore. And I didn't go into it to be put on some pedestal. But it's hard when you're seeing patients and they come in with their list of what Dr. Google said and are questioning your 16 years of expertise.
Right.
I always like being challenged, and I love patients who are engaged. But there's a line at which it becomes, you're missing the art of what I do. And that can never be captured on a ChatGPT prompt or a Google search. Or some online digital pharmacy. So I hope I have another opportunity to come on, Jeremy. I really appreciate this.
Well, I love that, Dr. Pazona. Well, I appreciate the time here. And just to wrap this up, straight from the doctor's mouth, you're not going to get the information that you need from being able to train your Chat GPT because somebody trained you for 14 years and in 20 years of practice. So, let's let the physicians do their work and leave the rest to somebody else. But really appreciate what you're doing with your practices. I've loved the time here, and I'm looking forward to doing it again. But thanks for coming on, Dr. Pazona.
Absolutely, Jeremy. Thanks, man.